My sole job on the corporate level is to implement and improve palliative care across the system. It is very important from a health system perspective when the goal is to have palliative care everywhere. As you know, how do you drive it? How do you get it done? And who will be leading the charge? And so a lot of lessons learned and mistakes are that when they try to have a person focused on driving palliative care across the system, they think it'd be part of any other day job another clinical expert can have. And that is not true. My journey was that a health system made the decision that in order to drive change at a health system level, you need the clinical expertise at the local level to be the driver for a palliative care initiative across the system. It's not something they do on the side or as part of their plate of what to do. It is really part of their only focus from a system level, from top down, also to bottom up. And you have to make sure on a C-suite level you have the clinical expertise at the table to also drive what are the quality standards. Really what the C-suite has realized is that in today's day and age of healthcare reform in the triple aim, when they say triple aim is about lower cost, better care, and the patient experience, they think this is all new. But when I sit back and talk to them, I say, but that's what palliative care has done all the time. We were the first ones 20 years ago to say, healthcare is about cost savings and providing the best experience of care. Back then, it was a fee-for-service world. There was no such thing as cost savings or cost avoidance. Now, fast forward 20 or 30 years ahead with our national debt because of medical spending, all of a sudden they're saying, wait a minute, we have to learn about quality care that is also cost effective. And then they're looking at palliative care as experts, where 30 years ago, cost savings was unheard of. It was about generation of money and fee-for-service. It was not about quality. Now we're in a different world, and palliative care has been in that world 30 years before ever healthcare reform was. So I said, well, healthcare reform is about really following the palliative care model of care. It's not care that should be done separately in a silo. It's about care for everybody, all access at all times for patients with a serious illness.